Okay, everybody, welcome to episode number 8. I've been looking forward to this week, this podcast all week. Actually, we actually have Dr. Scott Jacobson from Wishing Wellness Medical here in Las Vegas. However, he sees clients from all over the world. He does lots of cool things. He practices something called functional medicine that I'm highly interested in and I'd love to learn more about. We're also going to talk about how to keep our immune system in tip-top shape, how to keep our immune system strong and healthy during these times. However, first, I would love to know what inspired Dr. Scott to even go down this path of health and wellness, and how this whole journey began. So take it from
Sure.
there.
Yeah. I wanted to be a doctor from the time I was very, very little. It was kind of what I always wanted to do. As I got older, in my teens and 20s, I became, very interested in traditional Chinese medicine and, always wanted to go into acupuncture. I wanted to be an acupuncturist, but I wanted to have that medical background, to have that basis of Western medicine. And always kind of wanted to incorporate Chinese medicine or acupuncture into my practice at some point. Wasn't really sure how I was going to do it. And, I got caught in the hamster wheel of traditional medicine. Once you're going through medical school, residency, turned out I finished residency, started a practice here in Las Vegas, and was seeing 30, 40 patients a day. Just writing scripts, and, not really feeling like I was making a big impact, and saw a lot of problems with the, traditional healthcare system. And it just, I got burned out really quickly. So I started looking for other ways to incorporate Western medicine. I didn't want to, Eastern medicine. So I was always interested in yoga and Tai Chi. But I really started picking it up with a Tai Chi again. And Tai Chi is, it's like acupuncture, but with movement. And so that was something I started to get interested in. And then I got hired by this company called Iora Health. I worked with them for 5 years, taking care of a really sick population of casino workers who had chronic medical conditions, diabetes, high blood pressure, kidney disease, on dialysis, cancer patients. And cancer was rampant in this population. People with chronic medical conditions, which are almost always inflammatory, heart disease, diabetes, hypertension, these are all inflammatory conditions. These people are much higher risk for developing cancer because their bodies are so inflamed. Cancer just loves this, and your body can't shut down a cancer when it forms, which we're all forming cancers all the time, but our body should have the mechanisms to break it down. So I'm seeing all these really sick patients. I'm really feeling like there's, we're making an impact because I had a whole team of health coaches and social workers, and we were having these long visits. I went from seeing like 30 patients a day to seeing only, 5 to 15 patients a day, and getting to spend a long time with them, really talk to them about nutrition and how to change their diet, but still using lots of Western medicine. And I kind of found functional medicine at this time. I was kind of looking for a way to incorporate more of the Eastern type of practices into my practice, because I had the opportunity to do this at this practice. I was actually teaching Tai Chi classes for the patients 2 days a week. And so I was starting to do more stuff, but I wanted to learn more. And I came across functional medicine. And I went to my first conference and was just blown away. This is exactly what I was looking for. Functional medicine is really combining Western medicine with a lot of those ancient practices that we see in China and India and Native American culture, and kind of looking at those through the scientific lens and looking at them through basic sciences and how our immune system, how our energy production system, our hormones all interact, and why these things work, why acupuncture works. And so that's what functional medicine really does. And so it is also like Chinese medicine in that it's a completely different way of thinking about the body. When I was in medical school, we kind of were taught medicine in little boxes. So if somebody comes to us with a certain complaint, we kind of, say, well, what organ system is the problem here? So somebody comes to us with heartburn. We say, okay, well, you have too much acid in your stomach. What do we do? Well, we give them a medicine to reduce the acid in the stomach. That works great for some people. Somebody else might come with asthma or allergies, and we say, oh, their mast cells are producing a lot of histamine in reaction to the pollen in the air, their dog or their cat. So we'll give them some antihistamines or medicines that block the histamine receptors. So we're not preventing them from having this reaction or explaining why they're having this reaction. We're just putting a Band-Aid on it. We're saying, okay, well, we have a medicine
Right.
or we have a surgery that fixes it. Functional medicine takes a step back and says, okay, well, you have too much acid in your stomach. Well, why is that? Western medicine doesn't have a good answer for that most of the time. We don't really take that extra step and say, we have really good understanding what exactly is happening on the physiologic level, but not really good at explaining why does that happen in some people and not in other people. And so that's something that functional medicine really tries to dig into. What are those root causes? What are the things that are driving all these chronic medical conditions? And what I see when I see patients is that no matter what complaint they come to me for, it's the same root causes. It's not usually one root cause. It's usually a combination of a whole bunch of different things, which is one of the big criticisms of functional medicine from the Western medicine community, which is, well, you don't have any randomized controlled trials saying that, that your treatments work. And the reason for that is because they think about disease in a totally different way. If you take all the people with reflux or acid reflux, let's say, and we give them a functional medicine treatment, like let's say apple cider vinegar. Well, and we do a study on that. Well, that may work in some people, but in other people it's not, because the root cause of the problem is different in different people. So we have to treat that root cause. It's not the same as in Western medicine, where, well, the problem is too much acid, we'll give them medicine to reduce it. Well, apple cider vinegar may buffer the acid in some people, but they may have SIBO going on. They may have candida overgrowth. There may be different things. They may have a slow transit time in their gut. So unless we address that root cause, they're not gonna be able to get off the medicine that they're on.
Wow, that was fascinating.
Yeah, thank you.
Yeah, that's what I love this quote on your website. Functional medicine addresses the root cause of disease in order to restore and maintain health. And I definitely related to it. And yeah, so let's get more into it. So one of the benefits, like you just mentioned, is you have a limited amount of clients that you see. So then you have them on a personal level. You're able to spend more time, and you're able to. It's like each person you look at in a different lens, is what I'm hearing.
Sure. Yeah, absolutely. Every patient that I see, I spend a lot of time with them. My initial visits are usually 90 minutes to 2 hours. And I really go through their whole life story, because I really want to identify what are those triggers, what are those mediators that are interacting with their genetics, with their belief systems, with their attitudes. And how do those things interact to create their signs and symptoms? And to do that, I need to really go back. I start, with people's whole life story, going from even before they were born. What were their parents' lifestyle habits like before they were born? Was there, smoking or alcohol use during pregnancy? What was the pregnancy like? What was the delivery like? Were you breastfed? All of those things. What was your childhood like? And really going through and really creating a timeline of all their events. Like, when did their illnesses first start? And so I can really piece together which areas of dysfunction there are, because functional medicine, we use what's called a functional medicine matrix, and really what it is kind of a different way of thinking about health. And so we look at their hormones, their skin, their gut, their energy production. Are there toxins in the environment? All of these things. are contributing factors to what symptoms they're having right now. And so until we identify where all the problems are, we can't fix them. So we need to know all a very in-depth history and how they got to where they are, because and just telling their story is really important too. The mind-body interaction is really, really important. So it's not just their physiology and their genetics, but it's their beliefs, it's their attitudes, it's what happened to them as a child, their traumatic experiences, how all of those things interact.
Wow.
That really produce people's signs and symptoms.
So you take a lot of the mindset from all these different things, create the ultimate formulation, and then like you bring in the Western science where like in a functional medicine, like would you like check do a blood test, or like what type of test would you do?
That's a good question. So once I identify where I think the problems are, that's not the end. Then I formulate a plan of like, how do I test my hypothesis? This is what I think is going on. How do I test it? So then I start doing testing, and there's a number of different tests that I do that are non-traditional. I do a lot of traditional blood tests as well. I check people's thyroids and their blood counts and their iron levels. Those you would get at a traditional doctor's office. But then I also check their hormones. So I use a saliva and urine test where it checks all of their hormones, or the majority of their sex hormones, so their estrogen, progesterone, testosterone in both males and females, and also their adrenal hormones. So adrenals produce cortisol, which is the stress hormone. And this is a big problem. We're under so much stress in our society that almost everybody I see has some form of adrenal dysfunction. So their adrenal glands aren't producing cortisol optimally. Now, and so by checking not just one cortisol level, because our cortisol levels bounce up and down throughout the day, and usually a very predictable pattern. You're low in the morning, you shoot up in the first hour after you wake up, and then slowly comes down throughout the day. And so in order to know if your levels are normal, you can't just check one level, which is what a lot of times, an endocrinologist would do is, they check your 8 a.m. Cortisol, and that's it. And you might have normal levels then, but then you may not produce that peak, an hour after awakening. You may not produce, or you may be flat the whole time, or you might be through the roof if you're under like constant stress all the time. So there's many different patterns that we look at. So when I check people's levels, I do saliva tests, when you wake up, and then 30 minutes after, then 60 minutes after. Then I do it, in the afternoon, and then I do it before bed. And then also some other tests in between those with the urine. So you get all the metabolites, so not just the cortisol itself, but cortisone, which is an inactive form of cortisol. So you may be producing cortisol, but then your body may be inactivating it. So you're not getting the benefit from it. So you may feel tired and lethargic all day because of your cortisol level. So that's definitely one huge test that I do in my practice. Another one is the gut. The gut is I was going to ask that. The cornerstone of functional medicine. So what I've been seeing a lot in my practice, I see a lot of leaky gut because I see a lot of autoimmune disease. And this is a functional medicine theory of autoimmune disease, is when your gut is inflamed, that barrier, that's a very important barrier that's supposed to keep out all of the invaders that are trying to get in, but still allow all the nutrients and minerals and things that your body needs. And so it has a very important job. And when that gets disrupted, then you start letting things into your bloodstream that aren't supposed to be there through the gut. And that's what stimulates the immune system. It can cause systemic inflammation. It can cause autoimmune diseases like lupus, rheumatoid arthritis, Sjogren's syndrome, multiple sclerosis. All of these autoimmune diseases are becoming more and more common in our society because our guts are in such a mess, because of the diets that we eat, the toxins that we're exposed to, the chemicals and plastics, fertilizers, all the things that are, that are in our food supply and our water supply, not to mention all the stress. All of those things contribute to the gut barrier. And when that gets disrupted, that causes a whole host of problems. So I always start in the gut. I do a comprehensive stool analysis that looks at all of the gut bacteria. So we have these, all of these bacteria in our gut that are really important. They perform a lot of functions for us, and they can have a big impact in our weight, in our mood. There's a lot of neurotransmitters in our gut. And so by looking at the gut microbiome, all of the microbiome is all the different bacteria that are in there. I analyze all of the different bacteria, look at the proportions, see if we need to supplement with probiotics or prebiotics, which are fibers that these good bacteria feed off of. Or do we have some overgrowth of bad bacteria? Do we need to do a round of herbal antibiotics to kind of kill off some of the bad bacteria, so then we can have fertile ground for the good bacteria to grow? It also looks at signs of inflammation. So there's a test called fecal calprotectin. This is a test that they're using a lot in Western medicine now to differentiate between IBS and IBD. IBS is irritable bowel syndrome. There's no test for that. It causes alternating constipation and diarrhea, bloating. It's become very prevalent in our society. And then inflammatory bowel disease like Crohn's and ulcerative colitis. These you can see on a colonoscopy. You see ulcers and lesions and bleeding in the intestines, in the large intestines. And what they're doing now is doing a stool test. If somebody comes in with, they're not sure if they're IBD or IBS, they could do this fecal calprotectin. And when it's elevated, it means there's a lot of inflammation. It's much more likely that this is inflammatory bowel disease as opposed to just IBS. And so functional medicine, uses this. And I run this test a lot, and I see a lot of inflammation in the gut. I see this calprotectin elevated. It doesn't mean they have inflammatory bowel disease. In fact, earlier in my career, I would get really excited when I see an elevated calprotectin, have to send people to the gastroenterologist, get a colonoscopy, and find that, well, there's no lesions there, no ulcers that would suggest you have ulcerative colitis or Crohn's, but yet there's the calprotectin's elevated. Well, you have all this inflammation there. And then when I work with them, we change their diet, we support their immune system, we support their adrenal glands, and I, recheck it in 3 to 6 months, and the calprotectin's back to normal.
Wow.
So I'm not sending people for colonoscopy anymore right away. I'm waiting to see that, see those diet and lifestyle changes first, rechecking. And if it's still elevated, then sending them.
Wow. Well, I definitely respect you for always searching for more answers and searching for truth. So that's incredible. So you mentioned something at the beginning of the episode about inflammation.
Sure.
Being a real big issue in our bodies, However, would you say that it's really the gut should be our number one priority? Would the gut help the inflammation, or what happens first, the gut or inflammation? What happens first?
Yeah, no, my feeling is inflammation. And like I mentioned, I think toxins in the environment are a big part of it, but I think diet is the biggest one. And that's something that I work with my patients tirelessly, is working on the diet, because diet is really everything. So if you're eating healthy, then you're going to reduce the inflammation in the diet. So I work with a wide range of diets. So there's not one right diet. I have people who are vegan. I have people who are autoimmune paleo, or just regular paleo, or keto, or vegan. All of these different diets have their own ins and outs, and I've tried all of these diets myself. I've experimented on myself because I want to know what it's like to actually go, because these are challenging diets to take on. It takes a lot of planning. It takes a lot of motivation and willpower, and so I've had to experiment on myself to try doing these things. And what I found is that there's different diets that work really well for one person, but for another person, are going to be bad, and in fact cause inflammation. So one of the things I usually start with is what's called the elimination diet. And that's a way to really identify what is triggering inflammation in you. Because, there are certain people who can tolerate tomatoes, and that's great, and that's no problem. but in other people, it just inflames their gut terribly. And so there's not one right diet. We need to really figure out what the right diet is for you. So I gave the example of tomatoes because they're a nightshade. Nightshades are notorious for causing inflammation. And it's part of the autoimmune paleo diet to eliminate nightshades because so many people get really inflamed. It triggers an inflammatory response in the gut, which then can lead to leakiness in the gut, which then can lead to systemic inflammation, so inflammation in the whole body. And so really personalizing my nutrition recommendations is one of the things that is a big part of my practice, because I need to find out what's triggering inflammation in each individual person. And we know inflammation is a cause for things like heart disease, diabetes. You know, we've known for a long time people with heart disease, we think of it as cholesterol clogging up your arteries and causing a blockage, and then that's a heart attack. You know, you can't get blood flow to one part of your heart because it's filled up with this fatty plaque of cholesterol. So intuitively, we think, well, you know, reduce the amount of fat you eat, and then, you know, you won't get clogged arteries. Well, what we've known for a long time is that it's not just the fat. You need to have inflammation for that fat to stick to the artery wall. So when you have inflammation, it's like sandpaper rubbing on the inside of the artery wall, and that's what makes the cholesterol stick there. And so people can have high cholesterol but low inflammation levels, and they're not going to develop heart disease. Or somebody can have tons of inflammation and very low cholesterol, but their blood vessels are so inflamed that it causes them to build up plaque early on. So we know inflammation is important, and functional medicine really strives to reduce inflammation everywhere we can. So that means, you know, getting a lot of sleep. Sleep is one way to reduce inflammation. Exercise, you know, doing hot and cold saunas. You know, infrared saunas are great for inflammation. Reducing toxins in the environment. All of these things, and of course, stress increases inflammation. Blood sugar increases inflammation. So, you know, if you eat a diet high in refined sugar, that's going to increase your insulin levels. Insulin then increases the production of inflammatory cytokines. Cytokines are the chemicals in the blood that are released by the white blood cells that cause that inflammatory response. And so when you have high insulin levels, you have more inflammatory cytokines, more inflammation in the body. So that's why, you know, everybody, I recommend reducing sugar. If there's one thing you can do to be healthy, is no more sugary drinks, no more processed foods with added sugar, high fructose corn syrup, all of those things. If there's one food that's the biggest culprit for chronic disease, it is processed sugar, because it's such a driver of inflammation, and that's the main reason why.
Wow, yeah, I was just reading about that, and it's super addictive.
Oh, yeah.
Let's go into this, because this is one of the reasons I was really excited to talk with you today. If you look into the articles right now, there's a big mental health situation right now.
Sure.
And I think part of it is a lot of people feel fear. They don't know what to do. They're lost. They turn on the media. The media is only telling them, and I respect it, like you should. Like, wash your hands, wear a mask. Yeah, okay, cool. Yeah, perfect. However, there's one thing that everybody's missing, which I think is key, is the immune system. Can you share with them what the immune system is, benefits, and then 5 ways that somebody listening at home can do something like tomorrow to start boosting it, start building it up?
I think that's a really good point. We live in very uncertain times. And what is anxiety except fear of the future, fear of the unknown? And right now, everybody is living that, because there's so much uncertainty. There's so much we don't know about this virus. We have so much time because we're cooped inside. We're missing that connection, that connection that we have with other people. So all of those things are leading to much more anxiety in our lives, and so that's understandable. And so what's the connection between anxiety and inflammation? Well, anxiety, triggers changes in hormones. It increases cortisol. It increases that sympathetic response, that fight or flight response, increasing the neurotransmitters like epinephrine and norepinephrine. That's adrenaline. Those cortisol, epinephrine, and norepinephrine all increase inflammatory cytokines. So you've asked, what is the immune system? Well, and what is inflammation? So the immune system plays a very important role. And I could talk about this for weeks, literally.
Yeah, of course.
You take whole courses of it in medical school. And so it's not an easy topic, but what it is your immune system is there to fight infection, right? So as well as it has a role in, again, cancer. It has roles in fighting toxins. So all of these things, basically things in your body that aren't supposed to be there, getting rid of them. And inflammation is one of those ways that we do that. And what inflammation is triggered by is there's some insult to the body, whether it's a toxin or a bacteria or a virus, and it triggers your immune cells. The immune cells in the system are the white blood cells, and there's a whole host of different white blood cells that react to different things, different viruses, different bacteria, and they're all very specialized. And what they do when they encounter something, they trigger a cascade of release of chemicals called cytokines. Those cytokines then increase blood flow to certain areas, which is why, when you get stung by a bee, there's a release of these cytokines. Those cytokines then increase blood flow. So what happens? It gets red and hot because there's more blood flowing to that area. And so this inflammatory response needs to be modulated. It needs to be turned on when it's appropriate, and then turned off when the insult is resolved, when all the bacteria are gone, or all the viruses are killed off. Then we need to turn it off. So this needs to be in a very fine balance. And when we're under a lot of stress, we're more tuned to activating our immune system, and activating it even when there's no stressor there, no bacteria or virus. And so, or, there could be instances where our immune system is downregulated. And in which case, you're not going to be able to fight off a virus easily. And so regulating your stress is one of the best ways to regulate your immune system. So one of the ways, that I'm super passionate about are Eastern practices like yoga, Tai Chi, and meditation. All of these practices are similar in that they focus on the mind-body connection. So using your breath and movements and concentration to regulate your immune system, to decrease that sympathetic response and increase the parasympathetic response. So the sympathetic response is the fight or flight, where you're being chased by a bear and you need to get away. And so all of that blood is pumping. The parasympathetic is the rest and digest nervous system. So it slows things down. It gets your body more relaxed, and it regulates your immune system as well. So yoga, it's a great practice. There's so many different forms of it that it's really accessible to everybody, whether you do a restorative, gentle, or yin yoga practice that is holding poses for a long periods of time, 3 to 5 minutes, to really stretch out those muscles and increase blood flow where you need it. Or more active, like power yoga, like Ashtanga, where you're really building muscle strength, but also has a breathing and mindfulness component. So I really love yoga. Meditation is something that I've been practicing, since my 20s, and there's also many different styles. So finding a guided meditation or practice that's good for you, that works with you, is great. I like, just focusing on your breath. It's the simplest thing that you can do. A lot of people are turned off by meditation because it's so hard. It's really the easiest thing in the world to do in practice. It's just it's difficult. because, what is meditation? Well, you sit and you focus on your breath. Well, everybody, has problems focusing these days. The rates of ADHD and ADD are very, very high, but even people who don't have a diagnosis, have trouble concentrating. Concentration is hard, but that doesn't mean you can't benefit from meditation. In fact, if you're just sitting for 5 minutes or 10 minutes and focusing on your breath, your mind may be wandering 90% of that time. But if just once a minute or once every 5 minutes, you just come back to that realization, oh, I'm supposed to be focusing on my breath. Oh, I'm breathing in, the air is going in through my nose. Oh, it's coming out through my mouth. And, then, 2 breaths later, you're like, oh, I wonder what I'm going to have for dinner today. That's okay. It's that moment of realization, of realizing, oh, I'm focusing on my breath. That's meditation. And that's where the benefit comes from. That's the decreasing the parasympathetic nerve, or increasing the parasympathetic nervous system, decreasing cortisol level. So those are great, but my favorite is Qigong and Tai Chi. That's a traditional Chinese medicine, and it's been around for thousands of years. People have used it for health, for spiritual practices, and then eventually for martial arts practices. And so what I teach is medical Qigong, and it really looks at the traditional Chinese medicine system, looking at each organ system as an energetic body. And each body is associated with certain emotions, certain tastes, colors, and really using your imagination, your mindfulness to focus on each organ and purging out any negative emotions, negative energy that's in that organ system, and then using different exercises to tonify or strengthen those. So you can find where the deficiencies are in your body and then strengthen them. And I teach a whole program where you kind of go through systematically each organ system and try to strengthen and purge your organs to try to get your body in balance, because that's really what we're aiming for is balance. The traditional Chinese medicine is based on the yin and the yang theory, where there's a female and male component to every aspect of our being, and if you have too much of one, then it throws your body out of balance. So it's really finding that balance, and that's really what functional medicine is about: finding the balance in the hormones, in your diet, in your daily life, in your relationships, so that your body can operate on optimum health.
Well, let's this is perfect right here. Let's plug in, because Dr. Scott actually offers, it's complimentary, correct?
That's right.
Okay. He offers Qigong is awesome. I want to ask you one more question about Qigong.
Yeah.
He offers complimentary yoga, Tai Chi, and Qigong on Zoom, or what? You want to plug in?
So I usually, at times before the quarantine, I was doing classes all around the city in different places, usually a couple times a month. Right now I'm doing Zoom classes a couple times a month. Right now they're only open to my patients, although if people are interested, you can always email and ask any questions, and I'm willing to make exceptions.
Well, where can they find? I'm fascinated. Where can people find your information? Like your Instagram is. The thing I like about Dr. Scott is he actually practices what he preaches. If you go on Instagram, this guy is fit. He could do things that I can't do. This guy is awesome, and he really practices what he preaches. So can you share with them?
Yeah. So my Instagram handle is Wishing Wellness Medical. Also my Facebook page, Wishing Wellness Medical. Also, if you go to my website, wishingwellnessmedical.com, you can sign up for my newsletter, and that always has a review of my Instagram pages for the month, as well as any classes that I'm teaching, and some tips and tricks to eat healthy. I also have a food blog Instagram page called Dr. Chi MD. Chi is spelled QI, and you can see some of the things that I'm eating there. And you can see, and we also have a yoga page, Vegas Yoga, where my wife Ren and I, who works with me in my practice, she does some health coaching as well as um, a lot of my social media. So she does a great job there, and um, we've been doing acro yoga for many years, and so you can see kind of what we're doing there on the Vegas yoga page.
Oh, cool. Thanks for sharing. And I love what you were mentioning about meditation, because it's almost like, I don't know if there's a study that proves ever since like cell phones came into reality, if it increased, but like we have so much stimuli from cell phones, the TV,
Mm-hmm.
that is like sitting down for 5 minutes is unusual. Just breathing. And, back
It
in the
is.
day when we were like having a fire, like you probably just sit there, be with the fire, be present. Now you got the phone and everything.
Yeah,
But
we live
I
in
want to ask
age
you,
of. Yeah, go
I want
ahead.
to ask you one question about Qigong. Is it true
Sure.
that, like, I believe it's super powerful, so powerful at one point? Did the Chinese government like outlaw it at one point? Is that true, or is that just a like?
Yeah, I mean, I don't know that much about this. I know that there was well, it's kind of part of traditional Chinese medicine, so I don't think that they outlawed it. There is, I know, a branch of Qigong called Falun Gong that they did ban, that they were calling it a cult, and they were that they did ban it, but it is really a form of Qigong.
And
But
Qi pretty much means like your life force energy, correct?
that's right. And
Yeah.
Gong means mastery. So it's basically becoming a master of your life force energy.
Oh, wow.
Yeah.
So here's another question that I've been wanting to ask you. So, for optimum health,
hmm
would you recommend getting your nutrition from a whole foods diet, nutrition, or do you? I noticed on your website you recommend supplements. Is there like, so
Sure.
like
Yeah,
what's the best approach?
sure. So I always recommend, if you can get all of your vitamins and nutrients from whole foods, that's absolutely the best. That being said, not everyone can get all of the nutrients they need for their body to function optimally from a whole food diet. One, because our foods just aren't as nutritious as they used to be. So, if you can, grow your own food, or source good organic nutrients, and eat, 9 to 13 servings of fresh fruits and vegetables a day, you might be able to get everything you need, but you might not, because of certain genetic variations. In fact, I do a lot of genetic testing on people to look at what are called SNPs, or small nucleotide polymorphisms. And these are variations. They're not necessarily mutations, but just variations in their genes that may cause them to have um, higher need for certain nutrients. So a big example is the MTHFR mutation, which has been getting a lot of press lately for a number of different reasons, but it's involved in methylation, which methylation is the pathway in our body that uses for both inflammation and detoxification and energy production. And so people who have variations in this MTHFR gene are slow methylators. They can't methylate their B vitamins and their cofactors efficiently, and so they're going to need more B12 and folate than somebody who doesn't have these variations. So even if B12, of course, is mostly from animal sources. So if you're not supplementing B12, if you're vegan, then you're not going to be methylating efficiently.
Wow.
So that's just one example. There's a lot of course, nutraceuticals that I use that are for reducing inflammation in the body. Curcumin is one that I use, and I recommend for almost all my patients. I take it daily. It's just a really good anti-inflammatory, so reducing inflammation in the
That's
body.
in turmeric, correct?
Exactly,
Okay.
exactly. So eating turmeric, yeah, I use a lot of turmeric in my cooking. I throw whole turmeric root in my smoothie in the morning. I make a lot of curries. It's a really, great way to reduce inflammation in the body. But not everybody's going to do that. So some people prefer to use a supplement.
Right.
Probiotics are another one. I make my own kombucha. Follow my Instagram feed. You'll see how I do it. I have a blog on the website as well, where you can read how to make your own kombucha and kimchi and sauerkraut. All of these are probiotic foods. They're foods that have cultured bacteria that you can make yourself and have a huge wide variety to populate your microbiome. But not everybody wants to do that. They rather just take a pill. And so there's lots of probiotics on the market. And I use a variety of different ones depending on the need. Yeah, I do recommend those for a lot of different people as well.
Yeah, I definitely recommend following his Wishing Wellness medical page, because he has his own garden. So you could see, like, I was really fascinated about how you're making the teas out of the flowers and everything. So yeah, he does a lot of really cool things. Moving on, this is probably going to be one of my last questions. I've never really talked to an expert in this area. You also are an expert in like the CBD, medical cannabis, endocannabinoid system, correct?
Yeah, very good. Yeah,
So,
the endocannabinoid system, huge. I mean, so much in the news about the endocannabinoid system and CBD and inflammation. So we definitely know that CBD reduces inflammation in the body. I use it a lot for people with anxiety. I have patients who have seizure disorders who are able to control their seizures with CBD because it reduces inflammation in the brain. People with concussions, you'll see a lot of UFC fighters using CBD immediately after the match because it's been shown to reduce that inflammation in the brain, reduce the swelling in the brain to prevent post-concussion syndrome and traumatic encephalopathy that we're seeing, the CTE in football players and other people with multiple concussions. So it's a very versatile compound. So I'm using it a lot in my practice, and the stigma is becoming less and less. People are less turned off by it. In fact, a lot of people are coming to me specifically for cannabis because of all the news. We're still, in the early stages of understanding, what dose and how to take it. So I work with a lot of people to, because there's so many different options. There's tinctures, there's edibles, there's vapes, there's dabs, there's joints, and so there's so many different, so much information out there. So a lot of what I do in my cannabis consultations is talk to people about what the best mode of administration, what the proper dosing is, how to make it work for you, and because it's a lot of trial and error, because there just haven't been the studies yet to really say. It's been a lot of trial and error on my part and finding what works for different people. And it really depends on what they're using it for and what their goals are. So that's a big part of what I do.
Well, I'm excited for the research to come out. That's going to be the future is going to be awesome. So people are fascinated. How can they become your patient? Like, what's the first step in contacting you to become a patient?
So there's a few ways. One is to go on the website, and you can sign up directly right from there. You can click the join now button, and you can become a member, and we'll reach out to you to schedule an appointment, or you can call the office. The number is on the website, or you can email hello@Wishing Wellness Medical if you have any questions. Ren's really good about answering any questions that you have.
Cool. And then, okay, so what's important to you? Like, what is the message that you would like to leave with the people that are viewing this, listening? What would be important for you to leave with them as a takeaway so that they could be more healthy, more empowered, etc.?
Yeah. Well, I think the one takeaway is your health is in your hands, and that a lot of the things that have happened in your life are not your fault. And may have contributed to the chronic medical conditions that you have. But if you want to become healthy or stay healthy, the best things you can do for your body are self-care. So that means getting a good night's sleep, exercising regularly, or having some mind-body practice. Being mindful of what you're putting into your body. Whether that's eliminating processed foods, eliminating sugar, or gluten, dairy. Or just eating a whole food diet is hugely important, and minimizing the stress. We can't eliminate the stress in our lives, but we can learn to become resilient. So whether that's taking up hobbies that give you that empower you, whether it's a creative activity or an athletic activity or just a quiet activity, finding something that you really enjoy doing, and then of course, working on relationships, having positive relationships in your life. And that means, maybe sometimes eliminating toxic relationships, because that's a huge, factor in overall happiness. So sometimes that's hard to do, but it's something that, can have a big impact. So that's a lot of stuff. Even if you just take one of those things, you'll see some impact.
That's what I learned. Just take little baby steps. Pick one area, work on it, master it, go to another area, master that, and then 6 months later, you're in a totally different place.
Yeah,
So,
absolutely.
Dr. Scott, it was amazing. Thank you for this.
Oh, my pleasure.
You gave us some incredible information. Help people reach out to you and take their health in their hands. And it was maybe next time we'll do this again. We'll have the official studio.
Yeah.
I wanted to get you in the official studio, but
yeah.
with the conditions, this is all good.
Oh,
Thank you.
right.
Anything else that you'd like to plug in, mention before I close?
No, I think that's pretty much it. Check out our Instagram and Facebook pages.
Cool. All right, guys. Well, thank you for watching episode 8 with Dr. Scott, and peace.
All right.